Hi, and welcome back. My name is Sheldon McLeod, and this is Thinking Out Loud. It's presented to you here exclusively on the Saltwire Network. And if you've not got your health, what do you have? What else matters? And, we have often talked about the challenges with our healthcare system. And something happened recently. A Quebec-based company had opened private clinic, and there's been some news coverage about it. Perhaps you saw or read about that. And there's some folks who are worried that it's a slippery slope away from the public system that we have, but we know that there are challenges there. And what I wanted to find out more about is what would perhaps compel someone to want to access services above and beyond what the public system offers. And I saw a post on Facebook from someone who's been a Facebook friend for quite some time, who said that they gave their reasons for doing this. And I wanted to talk a little more about that. And Teresa Babb is here with us. And Teresa, thank you so much for doing this. Appreciate it.
It's my pleasure, Sheldon.
And where are you at right now? Where are we connecting with you?
I'm in Dartmouth, Nova Scotia, sitting in my lovely home on the Halifax Harbor, and just taking a quick break from work to have a chat with you.
And I very much appreciate that. So this clinic, is it close to where you live right now?
It's not that far. It's on Windmill Road, so it's a 5-minute drive, I guess. Mm-hmm. Yeah.
And when you heard they were opening and that they were asking people to pay a monthly fee with an additional fee if you go to visit,
right.
What about that was appealing to you?
Nothing. I read the article, I think it was last week or the week before, about Algomed. I think that's what they're called. And I didn't, I have very strong opinions about what's happening with our healthcare system now that it has collapsed, and I think that's official. But I have some health issues that I've been trying to get addressed for 3 or 4 weeks now, and I've become quite concerned. So I decided that because I did go to Emerge a few weeks ago and was told my wait would be somewhere between 8 and 12 hours. And I was having trouble catching my breath. And so she told me to go have a seat in the waiting room, and there were no seats. And if you can't breathe, standing up can become very difficult. So I ended up leaving after a rather extended stay. And things have gotten worse. And so I started thinking about, what can I do? What can I do? I don't have a family doctor. I do occasionally see a nurse practitioner, but she's away on vacation. And so I thought, what other choice do I have? And so I registered with them the day before yesterday. So you register, you pay for your appointment. You can subscribe for a month or a year. So I subscribed for 1 month, and my appointment was this morning.
What was that experience like?
The appointment was interesting. You don't see a physician. I saw a young nurse. The office itself is fairly large, but completely empty. And I just heard a voice. There's no reception area. So I just kind of stood in the middle of the floor and said, hello. And so she called me down, and I went into the second office, and there was a young woman there who is a nurse. And how it works, Sheldon, is she wrote all of my concerns down. She only checked my blood pressure and my temperature. And so she'll compile all of her notes, send them to a nurse practitioner who will review everything, and then get back to this nurse with her suggestions and, any requisitions that I might need. And the nurse that I saw will then email me what the next steps are. Very unusual. It's very different from going to see your family doctor.
Now, if you end up in Emerge, you have your health card, which has some information, but usually it's a family doctor that holds your records for the most part. So right. Are they able to know anything about your history other than what you disclose?
Nothing.
So does that concern you in any way about the treatment and the perhaps guidance that you'll get if they don't know the entire picture of your health care situation?
Oh, absolutely. But I think I would be more concerned about people who are not comfortable pushing. I will not walk away without, making sure that everybody has what they need. I have a background of about 25 years in the healthcare world, and I sort of know how to talk the talk in that world. And so, if I felt there was anything they really needed to know, I would have said that. I told her all the medications I'm on. I discussed, surgeries in the past, what's happened to me recently as far as weight loss, and I had surgery on my shoulder, and but beyond that, if I was somebody who didn't really understand how it all works, I would be very concerned that they don't take my health card number and they have no access to the systems available in Nova Scotia, at least, for physicians to look at our health records.
And to carry that to the next logical step, whatever treatment or remedy they prescribe, your doctor, if you had one, wouldn't know about that, or the system necessarily wouldn't know about that. So is that
Not at all.
how does that fit with the overall sense that this is something you felt you didn't have a choice, that you couldn't wait? You were one of those folks who showed up at ER and left without being seen.
Right. So it doesn't fit, Sheldon. What if I forget that I've seen them and they've, she asked me if I needed a refill on my prescriptions. Well, okay, so if you can refill this, this, and this, my family doctor won't know that, or my nurse practitioner won't know that I've had my medications refilled. What if, I forget something that I should be telling my nurse practitioner? There will be no notes for her. So what I've done is I've written everything down in my day timer, just so I don't forget what we discussed today. So I can tell the nurse practitioner the next time I see her. But I couldn't get an appointment with her until the end of August or early September, and I just couldn't wait any longer.
Right. And I think that's what is attractive to this system. But as we say, there are some challenges, and for critics, no, this is not a commercial in any way. I mean, this is about information, and I wanted to share this information to find out more from someone who took advantage of this. Who do you think this is set up for then, Teresa?
People like me, who just can't wait any longer. And, but it's not going to help with respect to getting in to see a specialist. It won't help with regards to having to book an X-ray appointment or blood work. Those are still going to be 3 to 6 weeks, and some are even 3 months for certain types of diagnostics. And then, of course, ultrasounds, we can't even talk about that. That's just off the charts as far as the wait times go. So really, it would be great for someone who just needs a quick diagnosis of something that is sort of mainstream, and maybe a prescription, and that's it. But this isn't really going to help me because nobody listened to my lungs. It's confusing. I have to say, it's very confusing. I want to think that they haven't, sorted it all out yet, but I think I'm probably wrong. But there it is. This is the beginning, I guess, perhaps, of what I can only call the end, because it does really feel like we've been left out in the cold by our healthcare system, but that's only because healthcare is political.
We know that the people involved with delivering the services are doing all they can. They have, incredible empathy and compassion. Yeah. And of course, the load of work, as we hear, is causing burnout and stress.
Sure.
I'm not sure how healthcare workers look at this. I know that some people in community, though, say this is the slippery slope, as you've just described. And if you had, again, I think to be respectful, the ability or means to pay for additional follow-up, for more private health care, do you feel that this is perhaps cracking the door open to that?
Absolutely. Absolutely it is. There is another private healthcare clinic of some description here somewhere in the city. I can't recall the name just now. But you can go there and pay an enormous amount of money to have an x-ray or an ultrasound, and I'm not talking about the MRI clinic or the what I call the private hospital behind the Dartmouth General. This is something entirely different. And when I looked at that website, it sounded like it was geared more toward the executive world, but it's there if I want to access it. And I don't think that even if I could afford it, that I would go, simply because it's just too troubling to me to have a two-tier system. I can't wrap my head around it, not in this province, and certainly not in this country.
And even though you took a veil of this opportunity, you're still not convinced it's the way to go.
Oh no, I don't think, Sheldon, that I would go back.
Right. You mentioned that healthcare is political, and Premier Tim Houston released a video where he said, we're doing what we can to get us to this goal. We've hired more doctors. We've hired more nurses. What do you want the politicians to know about this experience, and what needs to be done to help Nova Scotians right now in the system that has, in your words, collapsed?
Well, I really don't know that it has that much to do with hiring more doctors. We have a lot of doctors living in this province who have decided not to go through the rigmarole that they'd have to go through in order to be certified to practice in Nova Scotia, which I think is absolutely outrageous. I know of a married couple who are both physicians who came from the Czech Republic, and this was a few years ago. She's a dermatologist who is now practicing family med, because she didn't want to go through that whole system of recertifying or certifying to work in Nova Scotia or in Canada. But because the IWK was so desperate for pediatric psychiatrists, he didn't have to go through that, meet those standards or whatever it is that they ask of physicians who come to Canada from abroad. So we have them here. Why aren't we certifying them? And why do we keep pouring more money into a system that isn't working? I mean, that's just good money after bad. There's too much bureaucracy. There are far too many people working in the system who are unionized, so it's very difficult to undo that. But it is fixable, Sheldon. I know that it is, if it was taken out of the hands of politicians. I truly believe that.
Well, I do appreciate your candor, your honesty, and all that you post on Facebook and Twitter. I do certainly follow that, and I knew you'd be quite strong in your opinions. So I do thank you so much for being willing to talk about this with me today.
For sure. Have a great day, Sheldon, and thank you.
Teresa Babb is in Dartmouth, speaking with us about her experience going to a private healthcare clinic in Dartmouth. Thanks again.